I just want to give a quick keynote presentation to set up the floor. So I'd like to discuss about how we can mobilize investment for our national health agenda. And particularly, before we go there, we need to understand where does our health sector stand right now. So over the last 50 years, since our independence, the health sector has come forward a lot. From the life expectancy যদি বলি, it has increased from 52 years to 72 years over the last 50 years. 1990, from 1 lakh pregnant women, we have seen that 534 used to die, which has gone down to 273 by 2016. And we do understand that the government hospitals has increased to 600, and there is around 15,000 community clinics and satellite clinics. But then again, we can see that the GDP of the healthcare market against the country's GDP, against the country's expenditure, there's a big difference. Roughly 11% of the total country's GDP is spent on healthcare, whereas 5% of the national budget has been allocated for the healthcare sector, which is less than 1% GDP. But definitely we see that the Bangladesh healthcare market is growing rapidly. Back in 2017, it was roughly around 6.6%, and this can be over 10 billion by now, aggravated by COVID. So it's mainly because of the growing MAC population that has driven up the consumer appetite for it from all over the country. We also understand that the health insurance coverage is still less than 1%, so there is a huge opportunity over there, and roughly 72% of the total healthcare expenditure comes from the healthcare spend. So despite this, we do see that a lot of our money is also going outside, because a lot of people are going to India, Singapore, and Thailand and other places to take healthcare services, and that accumulates to around 2.2 billion. So there are huge opportunities we see there. So clearly, we understand that donor funding has definitely played an instrumental role in the transformation of Bangladesh's healthcare sector. And it has helped to lift millions out of poverty. It has helped empower women and marginalized individuals, as well as facilitated the access of basic healthcare facilities. But we do see that there is a decline in terms of the fund. Roughly in 2000s, when the foreign aid was approximately 5% of the total GDP, now it has come down to roughly 2% of it. And as well as we also see that the category of foreign aid is also transitioning. Whereas back in the 90s, there was roughly 20% for food aid, which also been accumulated for healthcare as well. That has rapidly shifted, and most of it goes into project aid. So this definitely signals the start of a development sector's evolution. So this is where we can actually introduce blended finance to bridge this financing gaps with the help of private sector. We do understand that if the public or the philanthropic resources can be used strategically, it can mobilize new private capital for development outcomes. And for countries like Bangladesh, which is a developing market, it will definitely help overcome a lot of multiple barriers to spearhead the healthcare sector. In Bangladesh, we do see that there are opportunities to bring in private capital in the form of new funding or in-kind investments from multiple sources, such as it can be private banks, impact investors, a lot of high net worth individuals who are interested in the healthcare sector. And we can also look into the pharmaceutical or the medical technology companies who are already playing in the market to invest here to help improve the value chain further. we do see that the traditional development finances, they were mainly provided in terms of grants or technical assistance, and they were solely provided to the implementer who are focused in diminishing the development outcomes. But that was solely dependent on one source of fund. So definitely when that fund runs out, so does the implementation sees a halt as well. But if we introduce blended finance and use the investments and the funding from the development partners to de-risk the implementation program, it can actually attract private financial institutions, and they can provide equity or debt instruments and help reach those development outcomes. So development finance definitely offers multiple benefits. The first one is it will definitely increase the funding towards development outcome. Right now, we have a huge deficit in terms of reaching the SDG goals by 2030, and definitely COVID has aggravated it further by diminishing the previous results that has been reached. So leveraging additional capital with the philanthropic and public funding will definitely help improve those opportunities. And there are a lot of other programs which also require some further investments and funding. So definitely grants and highly concessional capital can be utilized to de-risk and improve their financial return so that they can attract more private capital. Definitely, blended finance can be used to improve the sustainability. So if it is strategically deployed, blended finance definitely plays a transitional role by catalyzing investments that the private sector can scale and even replicate after the exit of the donor capital. It can also be used to stimulate innovation in projects which would require a return after a long time. So definitely that those kind of investments can be de-risked in the high impact sectors where normal market fundamentals might not function adequately. And it's definitely very important for Bangladesh because we have a huge unserved segment in which requires a lot of services. So definitely those products and services can be innovated to reach them. And lastly, definitely blended finance can be used to develop the local capital markets. It can definitely help by de-risking entry into the market and definitely deepen the local financial market. And it can even introduce more innovative instruments that can be utilized by impact enterprises, startups, and SMEs. And definitely, if that opportunity arises, we can use that foreign capital to advance the growth and sophistications of the local businesses. So globally, we have seen that blended finance has been successful in terms of mobilizing private capital. Since 2012, in the last decade, since 2012 to 2020, we have seen that there is a 14% cumulative annual growth in mobilizing private capital from 15 billion to 45 billion. And roughly that has been mobilized 2/3 by the governments, development agencies, foundations, and other development financial institutions in impact sectors. So from the commercial investors, we see that there are multiple types of players involved, starting from commercial asset manager to financial institutions and other businesses and PVC firms as well. And definitely we see that healthcare is also emerging as a major area of capital deployment, where we have seen that the global health sector funding has grown up to 31 billion in 2021. And that was majorly because of the COVID pandemic and the chronic diseases those are increasing. So the question is, we need to understand, where does Bangladesh stand in terms of promoting blended finance? So with comparison with other similar countries, we see that Bangladesh um, has an upper middle score in terms of measuring private market as well as health system status, but still it needs to be in the build stage where definitely more innovative financing tools, vehicles, and instruments has to be introduced so that these blended finance instruments can be promoted and it can be widely accepted. So lastly, my recommendations would be to propel blended finance, some very simple ones. First of all, we need to improve the impact management and measurement to promote the transparency of, of blended finance projects, mainly because these practices are not well known by the private sectors. So once we publicize these tools, practices, and the knowledges, this will effectively increase their awareness and their attractiveness. Second, we also need to publicly advocate to mobilize private corporations in healthcare. So easily what we can do is we can bring in regulations to for the provisions of CSR funds that can be used as risk capital in impact innovation initiatives in the healthcare sector, as well as we can also implement tax return incentives for corporates to invest in blended finance structures. Thirdly, we must promote an investor-friendly ecosystem because we need to reduce the flow of foreign capital in the country. So as soon as we make it more easy for it to come with less entry barriers and easing the repatriation of profits, we'll have more foreign capital interested in our local healthcare industry. Lastly, we can definitely provide incentives to healthcare startups. We see that over the last decade, $800 million of investments has been brought in, but roughly 30 million has been invested in health tech startups. So there are positions to bring in more capital. So definitely, if we incentivize them and help them improve their business performance as well as their attractiveness, further investments can actually propel into the sector.